If you found your small dog collapsed and not breathing, would you know what to do? This is a tutorial on how to give CPR to small dogs under 7 kilos. So you found your small dog collapsed and they're not breathing. You need to remember A, B and C. A is for airway, so open up their mouth, have a good look inside as far back as you can. Is there anything obstructing their airway? If yes, you need to get it out. We recommend doing so with a 1-finger swooping motion. Get it in their mouth to the back behind the object and pull it out. With smaller dogs, this is more difficult because there's less room to work, so be careful not to push the object further back into the airway. If, say, it's a ball that's got stuck and you can't get it out with your finger, place the dog on their back and extend their neck. With your 2 thumbs either side of the object on the outside, you need to push up and out, trying to dislodge that object. If you still can't clear the airway, you need to perform the Heimlich manoeuvre, but I'll do a separate video on this. So once the airway is clear, we move on to B, and B is for breathing. So we need to get down to chest level. Can you see the rib cage rising and falling? If not, place their nose to your cheek. Can you feel the breath on your cheek, or can you hear that they're breathing? Check their gum colour. If they're going purple or blue, there's already oxygen deprivation, so we need to move on to C. And C is for circulation. So take 2 fingers, place them behind the elbow. Can you feel a heartbeat? If you can't feel a heartbeat, can you find a femoral pulse on the inside of the upper thigh? If there's no pulse, no heartbeat, they're going blue and they're not breathing, we need to move on to CPR. So you need to make sure the dog is laid on a flat, hard surface on their right-hand side. And if you haven't already, make sure you call the vet to alert them of the situation. Now, there's 3 different ways that you can give compressions to small dogs. However, there's no right or wrong way of doing it. Whichever way you choose, it's basically personal preference, whatever works best for you. So the first way you can do it is just using one hand. Use the heel of that hand, place it on top of the heart, which is just behind the elbow, and you can give the compressions there. The second way is doing it with one hand. Place your fingers underneath, thumb on top of the heart, use one hand to compress. Make sure you're compressing like this and not like this. You need to be applying even pressure. And the third way is just doing exactly the same, but with 2 hands, one on the top, one on the bottom, and again, applying pressure like this. So it's all down to personal preference, whatever works for you. But you still need to be giving 30 compressions to 2 breaths, and your compressions still need to be 1/3 to half the depth of the dog's chest depth. So 30 compressions, 2 breaths. With the smaller dogs, you can place their entire nose and mouth in your mouth and give the breaths, whereas with the bigger dogs, we said you need to just blow in the nose. With the smaller dogs, place their entire nose and mouth in your mouth and give 2 breaths, making sure to watch that rib cage as you give them to ensure that you're delivering sufficient oxygen. You need to be delivering compressions at a rate of 2 compressions per second, and some people find it helpful to do this to the beat of staying alive, so this is what it should look like. After 30 compressions, 2 breaths. Straight back to the compressions. So keep going, 30 compressions, 2 breaths, and just keep going for a minimum of 2 minutes. After 2 minutes, you can stop just to check, is the dog breathing? Is there a pulse? Is the colour coming back? If at any point there is a pulse, there is a heartbeat, the dog is breathing, stop CPR, get them straight to the vet. If there's no pulse, no heartbeat, they're still not breathing, continue for another minimum of 2 minutes, but obviously go by whatever the vet is advising you on the phone. Just to clarify, with the smaller dogs, you always compress above the heart, which is just behind the elbow. If any of you watched my other video on how to give CPR to larger dogs, you would have seen that where you place your hand varies depending on what chest type the dog is. With the smaller dogs, that's not the case. It is always above the heart, which is just behind the elbow. So that is how you give CPR to small dogs under 7 kilos. If you haven't watched my other video on how to give CPR to larger dogs over 7 kilos, then please do head over to my channel and you'll find it pinned at the top. But I think every single dog owner should know CPR because you don't know if or when you might need to use it, and you could save a life.